Treatment of pelvic disease begins with identifying the causative condition. If it is caused by an insufficiency in the ovarian veins or in the veins that collect the blood of the uterus, ovaries, and intra-abdominal organs, which we call the internal iliac vein, the treatment is done by filling them with various plugs called metallic or liquid embolizing agents and eliminating the insufficiency. But in patients with pressure of the iliac vessels or the left renal vein, which we call May-Thurner syndrome or nutcracker syndrome, such as the pressure exerted by the vessels on each other, these areas need to be stented in order to treat the disease. If the ovarian vessels dilate due to blockage of these vessels in patients with chronic deep vein thrombosis, another patient group, this time the iliac vessels that are blocked, rather than treating the ovaries, can be opened with stents again to treat patients. If varicose veins in the genital area are involved in the work, treatments can be performed in the form of drying the genital varicose veins by injecting drugs into them using methods called liquid or foam sclerotherapy. Pelvic disease is a fairly common disease. It is known as the secret disease of women. The reason is that although these patients went to doctors from different branches, they could not get a diagnosis. In fact, it has a frequency that can be seen between 2 and 24% in women between the ages of 18 to 50. In especially what we call chronic pelvic disease, there is a disease under about 30% of our patients who suffer from pain in the groin areas, independent of long menstrual periods of 3 to 6 months, especially in women who have given birth 2 or more times. The incidence of the disease gradually increases. It becomes visible in about 1 in 3 women. Again, apart from these, there are women who have never given birth but have pelvic disease. In general, the underlying factors are long-term breathing yoga, activities that require holding your breath and pushing for a long time, patients who suffer from constipation for a long time, and patients that lift weights. These ovarian veins can cause dilation of the vessels, causing the appearance of the disease. Even one day after the treatment of our patients, their complaints decrease rapidly. After the treatments, especially in the first week, we usually check whether there is a problem related to the procedure and whether our patients' complaints have regressed. Then, in the first month, third month, and sixth month, we call our patients for a checkup and review the status of their complaints. Here, our typical control method is a physical examination and ultrasonography. Patients can also be checked with methods such as tomography and MRI if needed. We wish everyone a happy and healthy day.